bringing you the next in our series, Your Mouth is the Door to Your Health. And today I'm joined by our patient, Jacob, and his mom, Denise. And they graciously join us to share Jacob's story. And we'd like to start off by having you, Mom, please tell us what Jacob went through as a youngster up until the point you finally came in to see our office.
Jacob was 6 and he started with debilitating migraines. His migraines were, he would get severe pain, he'd sweat, he'd usually vomit. This would happen several times a month, and he would have to sleep it off. We took him to the doctor after several months of this, had testing done. They checked him from head to toe and said he was perfectly fine and that he should outgrow them. So this kept going on for a decade until he was about 16 when the dentist told me that he should be evaluated for braces. And I said to my husband, since I was already a patient of yours for TMJ, I said, he needs more than a pretty smile. Maybe Dr. Tammy can help. So that's when we brought him here. And within 2 to 3 months of starting treatment, he has no more migraines. And he's a different child.
So in that 10-year span from age 6 to 16, they said he would outgrow it. Were there any treatments that you tried? Did they put him on medication?
They said he might have allergies. So to watch for allergies. So we were watching everything, but there was nothing consistent as to when he would get them. We were watching what he was eating. We were trying different things to make sure he was on no spacing eating. So he would have breakfast, lunch, and dinner at the same times, but nothing was alleviating it.
So basically, the medical community did not have an answer for you.
No.
And then your dentist recommended an orthodontic checkup,
right.
Not even thinking about the fact that the migraines could be caused from the jaw.
Right.
So Jacob suffered from his lower jaw being out of alignment and pushed back too far, which was pinching his trigeminal nerve. And the trigeminal nerve is what is well known to cause migraines. So Jacob came to our office, went through the evaluation process, and we found that he did have a jaw joint misalignment. And then we presented a treatment plan to them. So we'd like to take a minute and have Jacob tell you a little bit about that process. So Jacob, we're giving you the floor now to share a little bit from your perspective. So would you like to start off by what it felt like from age 6 to 16 to not be feeling well every day or a few times a month?
It was definitely hard. I would start getting these migraines, and they're slightly debilitating in that I could not do anything during them. They were seriously disruptive. I couldn't concentrate. I had to sleep it off, or I had to eat, or I had to completely shut down my day to try and rid myself of this migraine. Well, as that progressed and I got older, they started interfering with some of our family trips, and it was just terrible trying to work around and schedule my days according to when I would eat, and trying to find a consistency and figure out the cause of them so we could plan and expect that I would have a good time and not be disrupted by a migraine.
Sure. So what thoughts went through your head when you came to a dental office and we said we could get rid of your migraines? Did you think I was crazy, or tell me what thoughts went through your head?
I first thought that it did seem a little strange to be seeking out a doctor who worked with teeth, and how that would come to help me with migraines. It did seem strange. I had hoped for a better smile and help with my teeth, but it did seem very awkward thinking how braces and all these things in my mouth would work upwards towards other parts of my body.
Sure. So Jacob had a complete examination, and we came up with a treatment plan. And then he did have to wear an appliance. These are called expanders, and they are upper and lower retainers that he was able to take in and out. And the way these worked is that they repositioned Jacob's lower jaw forward and away from the jaw joint and the ear so that the trigeminal nerve was no longer pinched. So would you explain about wearing this and how soon you started to feel relief?
Sure. I had started wearing this, and basically right away you could feel that it was doing something major inside of my mouth. It was moving around my teeth and adjusting my jaw. There was a little pain, but not enough that it was hard to wear. Being consistent was very easy with wearing it during the day, and slipping it in and out became easier as I wore it, but it was a very easy process.
And how soon would you notice that your headache started to get better after you started wearing the retainers?
Well,
Expanders.
within about a month, I had noticed a serious change in my migraines in that I was not having them quite as often at all. Within 2 months, I believe the regular recurring schedule that they had been operating on had completely dissipated, and I was very much cured of them.
Great, great. And I can tell you, I remember Jacob coming in and being very quiet. You wouldn't talk to us in the chair. Mom already mentioned he was grumpy, so I won't say that. But after a couple months, he blossomed. He would start having conversations with us, and now he's willing to be on camera. So it changed his whole outlook and demeanor. And so after wearing those retainers for about 6 months or so, then Jacob moved into braces, which he currently has on his teeth now. And so the braces are just used to align the teeth. The expanders and the bite blocks was the main way that we got rid of the headaches. And now the braces are being used to hold your jaw and to stabilize that. So have you had any problems with the braces as far as keeping them clean or eating certain foods?
It was difficult at first, as always, but as time went on, I was able to just get into the groove, and it was also a major help that they operated flawlessly with the appliance I was already wearing, because I could slip the appliance in and not even notice that it was also in my mouth with my braces at the same time. So it was very easy to concentrate on the braces because I didn't have to worry about my appliance anymore. And
Great. And one other symptom, I believe you had some trouble breathing through your nose when we first started.
yes, I played baseball, and so at a very young age, I noticed that I had trouble breathing when I was running. And later, my father and my coaches told me to breathe more through my nose, and it was almost a mystery to me because I never had the very steady ability to breathe through my nose. It was very hard to, on any day, if it was a clear day or not, I had trouble breathing through my nose always. So when I started wearing the appliance and it started moving my jaw, I was able to breathe through my nose some, and it started opening up my sinuses, and I was able to breathe more. Practices went smoother. It was definitely a much better experience. And then when braces were added, I can virtually breathe through my nose all the time now.
Awesome. So just to back up and connect the dots, his treatment started with the expander on the upper jaw, and he turned that with the key, and that actually widened the roof of the mouth, which is also the floor of the nose. So it made his nasal airway larger for more air to get in there. And then with the lower jaw coming forward, that gave his tongue a position forward and opened up his throat, so there was better breathing all around. So Jacob's almost finished with his braces, and then when he is all done, his nighttime retainer is going to look like this. So it's going to be an upper and a lower clear tray like most patients get after braces, but the difference is that it's connected on the side. So when you go to sleep at night, Jacob, your lower jaw is not going to fall backwards or pinch that trigeminal nerve again. So that's how we're going to prevent his migraines down the road. There's more space created in there for that nerve, but when we're asleep and we lose control, that jaw can fall backwards. So this is going to be your preventive tool long term. And I say long term, which means we want you to wear it as long as you can. But what we find is you already wear glasses, and that's part of your routine. You get up, you put your glasses on, you go about your day. Same with the appliance at night. We put it in at night, go to sleep, and take it out in the morning. So do you have any other thoughts that you would like to share with our audience about your experience, or just how you feel now as far as living a life without headaches?
Just that it's definitely worth it. To feel better and just be able to operate normally, it is worth whatever you go through along the way.
Well, thank you, Jacob. I think that's the general consensus that most of our patients agree on. And for his sake, he was very cooperative, and that has made a huge difference because you did what we asked you to do. You followed the instructions, and your brain knew it was good for your body, so it was easy to wear the appliances. So thank you very much for joining us today and sharing your story. Our office is called the Center for TMJ and Sleep Disorders. We are located on Route 10 near the Penske Building and across from Dan's at Green Hills Inn. We can be reached at 610-796-2835, and our website is tmjsleepcenter.com.